All right, let's continue with our shoulder anatomy zone evaluation protocol. We've already covered positions 1 and 2. Now we're going to pause to assess the Gautelier classification. This classification is extremely important for shoulder surgeons, as we already know. It was originally described in arthrotac, then in MRI, which is the most commonly used method today. It ranges from 0 to 4, from normal to pathological. And basically what we're interpreting is the amount of fat infiltrating the muscle and the muscle's atrophy. This is done with MRI. So in ultrasound, which has also been standardized, what are we looking for? Basically, instead of dividing it into 5 stages like an MRI, we simplify it. We divide it into 3 stages, where 0 is normal, 1 and 2. So from MRI, where we had 0, 1, 2, 3, and 4, here we're going to talk about 0, 1, and 2. And basically the interpretation depends on 2 things. First, the presence of the intramuscular tendon. We're talking about the supraspinatus, but this applies to the other shoulder tendons as well. So for the supraspinatus, the presence of this tendon the evaluation from cephalic to caudal through the Nevisir portal, for practical purposes when we perform surgery, is done in that position, as if we were placing a Nevisir portal in the supraclavicular fossa. And we look for this tendinous pattern, both in the long axis and the short axis. We'll see that in a moment. The first parameter, then, is the presence of this tendon, and the second parameter is the similarity of the ultrasound characteristics of this muscle. With the muscle that is in the same plane, in the same scan we do above it. In this case, that's the trapezius. So we evaluate the contour of the muscle, comparing it with the other surrounding muscles and the pattern of the central tendon, both in the long axis. With this anatomical drawing, as well as this other one in the transverse axis in the drawing, and really focusing on this, the central tendon. So if we start from the knowledge of the anatomical specimen, we see that in a normal stage, there is a central tendon and a muscle with healthy or normal characteristics. In stage 1 then, notice that the pattern, we've tried to simulate it here, starts to fade, and the muscle, which is already more atrophic, also begins to lose its characteristics compared to the others. Here, it's already more atrophy, and there is no longer any intramuscular tendon. So basically, 0 is normal, 1 is partial loss or sparing of the tendon, and stage 2, there is no tendon. The pattern is no longer visible. And obviously, the characteristics of this muscle, since it has fatty infiltration, will be different from the muscle pattern we're comparing it to. Let's take a look. So on a grayscale, what we're going to look for is this pattern of the central tendon, which starts to disappear at stage 1 and is completely gone at stage 2. Here, there's no tendon anymore. So now let's do a practical exercise to see how this would look in our image, in Y, in our axis view. Our short axis view, tendon fully visible, partial loss. We've already seen this in the long axis, now in the short axis. Look, here, there's no tendon anymore. This is what we've wanted to show with this drawing, and here we would also focus on this, which would be the tendon. Here it fades a bit, and here we've schematized a loss of it for this image. So in grayscale, what we're basically trying to see is this, the presence or absence of the central tendon with normal muscle characteristics. Here, both the tendon and the normal characteristics are lost in both planes. Don't forget that it should be in both the long and short axis. Try to look for the normal pattern of the tendon, partial fading or total fading, which is probably the easiest of the 2 criteria. The other one is actually easy too, and here it can be illustrated very simply. So look, this is the suprascapular fossa, the fossa of the supraspinatus. And basically, we then find the supraspinatus in the long axis, because that's where the tendon goes. This would be a Botelho 0. This is a normal pattern. If you compare the pattern of the muscle, skin, subcutaneous tissue, the first muscle, the trapezius, it looks completely normal, with fibrous septa, with anechoic images well organized. Notice that this healthy one looks very similar in its echogenic characteristics, with a tendon in long axis. This would be classification 0, 1, and 2. In the drawing, it's basically going to look like this. All of this is the supra, this is the scapula, our tendon. Now we evaluate it in the short axis. Notice that in the short axis, if this is our supra, this is our supraspinous fossa, the supraspinatus, then we're going to look for the central tendon. You can see it clearly here. This is an ultrasound of a healthy patient. So our muscle is very well defined, just like we saw in the long axis, here it is in the short axis. And you can compare the pattern of the trapezius, which is very similar to the other pattern of the supraspinatus. This would be the way to evaluate a normal guattaliar. Let's look at it in a practical exercise. So look at the position I was telling you about. We evaluate from cephalic to caudal, from the Nevacia portal, the whole fossa. Both in longitudinal, we turn our probe to see the direction of the fibers in longitudinal, which is how it looks here. That's a real image. So thank you. We can assess our tendon, our trapezius, and if we want, well, in the other axis, basically we would just rotate it. Our area at 90 degrees, as we've shown here. Go Tullier, important in shoulder evaluation.